Welcome to Mondays with Magda. Hey everybody, today we are interviewing Laura Colbert, Executive Director at Georgians for a Healthy Future. So, let's get cracking. What I learned about Laura has a master's degree at Emory University. Laura has been recognized at the Society for Public Health Education. Laura has a degree at the University of Georgia in kinesiology for biomechanics. And I had no idea. That is so cool. So Laura, would you like to share a fun fact about you that we don't know?
Sure. I think my fun fact is that I ride mountain bikes, and sometimes I even race mountain bikes. Not as much anymore, but every once in a while you'll catch me in a mountain bike race.
That sounds like so much fun, and I bet you really fast, right?
Oh, I don't know about really fast. I would say medium fast these days.
I understand that completely. So now I got a few book questions for you, if that's okay.
That's great. Let's do it.
Yeah. So the first thing I want to mention is I started in healthcare advocacy with Georgians in the driver's seat for non-emergency medical transport. Where are you with the non-emergency medical transport advocacy right now?
Yeah, so a lot of people don't know what non-emergency medical transportation is, but it is a part of the Medicaid program. And for people that don't have a way to get to and from their health appointments or to the pharmacy, Medicaid provides free transportation so they can get to see their doctors or to pick up their medication, that kind of thing. And it can be either picking people up in a van and taking them to their appointment, or it can be giving them like a free MARTA card or other public transportation. And sometimes it's even sending an Uber if that is the right method of getting to and from their appointments. So it turns out that this is really important, especially for people who have complex medical conditions, like people with disabilities, for people of color, and for rural communities. And because, often those folks may either need to get to their health appointments more often, or maybe they have less access to transportation. So that's why the Medicaid transportation program is super important, but it doesn't work very well sometimes. So maybe people get picked up like 2 hours late and then they miss their appointment, or maybe they can't bring a child with them because the van doesn't have room, something like that. So we've been advocating with you all to improve the program. And so we've been talking with the folks at the Georgia's Department of Community Health to try to improve that. So I think that they have, heard that it's important and valuable, and that there is also a lot of room for improvement. And right now we are kind of waiting on them to announce when they're going to kind of revamp the program. They do this program through contracts. So they do these big contracts with brokers, transportation brokers. And that's really the opportunity to help kind of influence the program, is when they do those new contracts. So we're kind of waiting right now on that. But in the meantime, I think we've done a lot of really good outreach and education through leaders like you about the program. And I think our leaders are hearing us.
That is great, because we need to have voices right now.
That's right. And you guys have really helped lead the charge, the Grassroots Connectors program.
Yes, we have, and we are so grateful that we are helping out on a really important matter.
That's right, yeah.
So where are you with the other key healthcare advocacy agenda items right now?
Man, there's lots of important stuff happening right now. Of course, with COVID-19, the really important stuff is to keep people safe, right? Keep them from
Right.
getting sick, and also to get the vaccine out in an equitable way. And then, one of the best things that would help Georgia right now, both in the pandemic and recovering from the pandemic, would be Medicaid expansion. So we have got a really
Yes.
high uninsured rate in Georgia. We have the third highest uninsured rate in the whole country. And Medicaid expansion would help cover at least 500,000 people so that those folks could afford to go to the doctor. And in many cases, those people are caregivers for people with disabilities. They are people who have disabilities but haven't been able to get kind of the official, designation from Social Security that says they are a person with disabilities. So this would really help folks, all kinds of folks across the state, but it would also help people with disabilities and their family members and loved ones. So we are really trying to advocate for Medicaid expansion. And I think our elected leaders are starting to hear us, and it would really bring in a lot. It would bring in $3 billion to Georgia every year, to Georgia's health system. So it would be a huge boost, especially as we try to climb out of the pandemic.
Thank you again for all this amazing, incredible advocacy that you're doing for our state of Georgia. Thank you, Laura.
Oh, thank you. We couldn't do it without partners like you.
Of course. And I also want to remind everybody to speak with your legislators for healthcare for disability rights, because that is very critical right now, especially during COVID. Make sure that we get the information out so that we can get these vaccines and get the best healthcare services for disability rights right now. Let's make this happen right now. What is your vision for a healthy Georgia to include people with disabilities?
I think my vision for a healthy Georgia is one where the health system treats every person with dignity and takes into account that they are a whole person. Yes. That is balancing many parts of life, not just their health. And that we all have an equal shot at living a healthy, successful life and whatever that success means to different people, right? So we know right now that a lot of Georgians, because of their race or their medical conditions, don't have an equitable shot at living healthy lives, and in many cases the health system doesn't work well for those folks. And so I think if we can address those shortcomings, I think we would go a long way towards meeting that vision of kind of a health system that really treats people as whole people, and a state where everyone can live healthy and thrive.
Spoken from the heart. I love it. That was awesome, Laura. Thank you so much. And I would love to know, do you have any closing statements for the audience?
No, I think you said my closing statement earlier about the importance of contacting your legislators and your elected officials. It's really important that the people who are impacted by policy are able to influence that policy. So if you're here watching Mondays with Martha video, then you are probably somebody who can get in touch with your legislator and talk to them about important health issues. So I hope folks do that, and I hope you tell your friends and your family how to do that, and that goes a long way towards making sure that good policy gets passed so that our health system works better.
I love that so much. I really do. And thank you so much, Laura. And I want to thank you again for joining us on Mondays with Martha. And for sharing healthcare advocacy updates from Georgia's with a healthy future. And thanks
you. Thanks for having me.
Oh, I love it so much. And thank you, our viewing audience. Please don't forget to subscribe to keep Martha's on for updates.